So the reason that ERA is really keen on doing the work on examining the intersections and the intersectionalities that are possible between gender, sexuality, sexual and reproductive health and rights, and psychosocial disability is actually a topic that has arisen through many of our conversations with our partners working in the region. We've had partners who talk to us about adolescent girls and who are seen as engaging in high-risk sexual behavior and sexual expression. Some of these girls are then considered deviant, and they're kept in rehab homes, and there's a whole programs that for them which are probably go against the concept of autonomy, choice, and their rights. There are also stories we have heard from our partners of young women who are suffering from postpartum depression, and this is seen as an analysis of the mingling of both the gender and sexuality roles of those young women themselves, and this is also something that is being less explored. So if we look at across the entire spectrum of sexual and reproductive health, mental health becomes an important aspect or an important service that needs to be given, made available to women, young people, and also men in order to ensure their well-being, including their sexual well-being and their reproductive well-being. And whether we're talking about circumstances like with regards, let's say, childbirth, right? So there's not only postpartum depression, but there's an entire spectrum. What of women who have had stillbirth experiences, or women who have had to undergo an abortion because of fetal abnormality. So there are always these support services that need to come into to ensure that women and men are able to continue their lives by providing them access to mental health care. Of course, in the entire spectrum, you can also find, let's say, women who have had a mastectomy as a result of cancer, or women who have had trouble conceiving a child, or IVF, or had to undergo a hysterectomy when they did not really desire it because of a situation in their lives. So I think that there's a whole range of points in which sexual and reproductive health should also ensure access to mental health services in order to really, if you're talking about not only treating disease, but looking at the well-being of people. So this is what makes it so interesting. And when we look at the sexuality angles of it, and we look at the rights angles of it, then we can actually say that that not only sexuality has been a way of organizing society, gender has also been a way of organizing society, but also reason versus madness has been another way of organizing society. So and rights are given to those who are able to conform to the norms. They may not fully realize it, but at least they possess their rights. And those who are deviant and do not conform to the norms are then deprived of their rights, because that is the way that society punishes those who transgress sexuality norms, transgress gender norms, and transgress mental health norms, right? So, so this is why we feel that, and then if you look at the intersectionality analysis, the vulnerabilities and the marginalizations that are experienced are multiple. So if you have particular sexuality that is in defiance of norms, then you are further marginalized and made vulnerable, and your rights are taken away. If you are, and the same happens within gender, and the same happens within mental health. So women who do have a sexuality that are different, or young people who have a sexuality that are different, who are breaking gender barriers, can also then be labeled as being not of sound mind, or not who are not sane, right? So I think that's one of the whole transgressing of boundaries, which is really essential, and why are we resistant to that? So we're hoping that this work will be able to give us an analysis of interrogating what is considered norms, right? And why is it that rights are given to those who are within norms, whereas if we are talking about a human rights principle, all of us are born inherently in possession of full human rights, and yet those who transgress clearly do not have their human rights at all.